Hello guys and welcome to our video about hydrogen peroxide teeth whitening. Using toothpaste containing hydrogen peroxide is a popular way to whiten your teeth. It breaks down stains on your teeth, but isn't harmful to the enamel of your teeth. While your body can repair some minor damage from the peroxide in your toothpaste, overuse can cause irreversible damage. If you're unsure whether this solution is right for you, talk to your dentist. They'll be able to recommend a safe hydrogen peroxide teeth whitening solution for you. 3% hydrogen peroxide. When you're looking to whiten your teeth, you might want to try using 3% hydrogen peroxide. You can find it in most drugstores, but you need to remember that you can cause burns when using a high concentration of hydrogen peroxide, so be sure to follow the directions carefully. You'll also need to mix the peroxide with water, so that it doesn't damage your teeth. Hydrogen peroxide used in whitening products has a concentration of 3%, but the concentration in drugstore teeth whitening products can be as high as 10%. It's important to remember that high concentrations of hydrogen peroxide can damage the enamel of your teeth, so you need to use it sparingly and for short periods of time. You can also mix equal parts of hydrogen peroxide and water and use it to whiten your teeth by using this solution for about half a minute. You can also use a homemade hydrogen peroxide mouthwash or toothpaste to whiten your teeth. Simply mix 3 parts hydrogen peroxide with 3 parts water and swish the solution around your mouth for 2 to 4 minutes. Make sure you do not swallow the solution, since it can damage the enamel of your teeth. It's also important to consult with your dentist before using hydrogen peroxide for teeth whitening. Home remedies for teeth whitening can be extremely effective, but it's important to consult a dentist if you'd like to use them regularly. In addition, many home remedies can be harmful to your teeth. Therefore, you should always seek professional help before trying any new teeth whitening treatments. The ADA recommends whitening products with a seal of acceptance from the American Dental Association, ADA. Carbamide peroxide. If you're looking for a teeth whitening solution that works fast, try carbamide peroxide. This water-soluble compound works by adding oxygen to your teeth. It works in similar ways to hydrogen peroxide, removing stains and discoloration from your teeth. Despite its negative connotations, carbamide peroxide is a safe teeth whitening ingredient. Watch to learn more about this ingredient and its potential benefits. While over-the-counter whitening strips can produce great results, they do have the risk of causing sensitivity. Because of the high concentration of carbamide peroxide, it is important to take a break after 2 weeks of using these products. If your teeth become sensitivity, try using a lower percentage product. It's also important to wait a couple of weeks between each round of teeth whitening, so the color can stabilize. Although carbamide peroxide for teeth whitening is a safe product, it should be used carefully. Some of the side effects include irritation and gum infection. The gels used by over-the-counter companies often use trays that overlap the gums, which can cause gum infection. Other possible side effects include air sensitivity, which occurs when breathing through the mouth, and thermal sensitivity, which occurs when you eat or drink something hot or cold. Carbamide peroxide is known to dehydrate living tissue, making it more sensitive to air and temperature changes. In people with a history of tooth sensitivity, carbamide peroxide may be more damaging to the teeth. Non-steroidal anti-inflammatory medications may help reduce the side effects associated with carbamide peroxide. While carbamide peroxide is the most common ingredient for teeth whitening products, it is not as effective as hydrogen peroxide for the same purpose. Hydrogen peroxide releases most of its whitening effect within 30 minutes of application, while carbamide peroxide releases 50% of its whitening power after 2 hours. However, it can remain active for as long as 6 hours. The downside of carbamide peroxide for teeth whitening is that it's a diluted solution and needs to be applied longer to achieve maximum whitening results. Over-the-counter whitening products. Many over-the-counter whitening products for hydrogen peroxide teeth whitening contain up to 20% hydrogen peroxide, making them more effective than a whitening dental treatment. Compared to the dentist's solution, most over-the-counter whitening products are safer for long-term use. In addition to whitening teeth, hydrogen peroxide also kills bacteria that contribute to gum disease and promotes gum health. However, some over-the-counter whitening products can cause gum irritation and make teeth sensitive to the peroxide in the gel or strips. Hence, it's important to limit applications and use rest periods between them. The main ingredient in over-the-counter whitening products is hydrogen peroxide. Peroxide acts as a bleaching agent because it can partially penetrate the layers of teeth and remove the compounds that cause discoloration. Most store-bought tooth whitening solutions contain 10% hydrogen peroxide. while dentist-dispensed whitening products can contain concentrations of up to 40%. Over-the-counter whitening products for a hydrogen peroxide teeth whitening procedure can be found in stores and online. These products usually contain a higher concentration of hydrogen peroxide than toothpaste. The effectiveness of over-the-counter whitening products is dependent upon the type of product and the lifestyle of the user. However, if you want to whiten your teeth quickly and effectively, you should consider an over-the-counter hydrogen peroxide teeth whitening product. In addition to hydrogen peroxide-based whitening gel, you can also find a number of whitening strips available over the counter. Whitening strips use the same formula as the hydrogen peroxide-based tooth whitening gel, and are best applied to the teeth twice a day. These products have a higher success rate than their dental peroxide-based counterparts, though you may need to repeat the procedure for 3 weeks before you see the desired results. Using hydrogen peroxide at home. Using hydrogen peroxide teeth whitening products is a popular trend that has become safe and effective. These products are inexpensive and easy to use. They can also take time to whiten your teeth, so be patient. This video will give you information about the safety and effectiveness of hydrogen peroxide whitening products. It is important to read the label carefully to make sure they are safe for your teeth. One of the main ingredients in many teeth whitening products is hydrogen peroxide, a natural bleaching agent with antiseptic, antiviral, and antibacterial properties. It can be found in many types of toothpastes and mouthwashes and is commonly used to prevent infections and minor cuts and scrapes. It is safe for home use if you dilute it with baking soda. However, you should be careful not to swallow hydrogen peroxide directly. Unlike some of the products on the market, hydrogen peroxide is safe for use at home when used properly. You can purchase hydrogen peroxide mouthwash on Amazon. However, if you are not sure about the safety of hydrogen peroxide, you should first consult a dentist. The ETA does not recommend using higher concentrations of hydrogen peroxide as these can be dangerous for your teeth. The ETA recommends that you use products that have the ETA seal of approval. Using hydrogen peroxide as a mouth rinse is also safe. Using a mouthwash made with hydrogen peroxide and water is effective for whitening teeth and preventing stains. While hydrogen peroxide mouthwash is not as effective as the products sold in the market, it can also prevent bacteria from forming in your mouth. The hydrogen peroxide mouthwash is meant to be swished around your mouth for 30 to 60 seconds. Rinsing your mouth with water afterward should relieve the discomfort. Avoiding high concentrations of hydrogen peroxide. When it comes to choosing a teeth whitening product, it is important to choose a product with low concentrations of hydrogen peroxide. These products should also be safe for swallowing. However, people who have thin enamel or inflamed gums should avoid using products that contain high concentrations of hydrogen peroxide. Before you decide to use hydrogen peroxide for teeth whitening, it is important to speak with your healthcare provider. While hydrogen peroxide is an effective teeth whitener, it should not be applied too often or for too long. Using the product for too long may lead to enamel damage. It may also increase sensitivity in the teeth. Fortunately, there are other methods that are safe. These techniques will also improve the appearance of your teeth while avoiding the risks associated with tooth whitening products. If you are a smoker, you should not use whitening products with high concentrations of hydrogen peroxide. While hydrogen peroxide is commonly used in commercial teeth whitening products, it is important to avoid overconsumption. Most products containing hydrogen peroxide contain 3% or lower. Commercial teeth whitening products can contain up to 10%. While this is low, it can still cause harm to your teeth if you use it for too long. For best results, use a diluted form and use the solution only for a short period of time. There are many risks associated with using high concentrations of hydrogen peroxide for tooth whitening. Not only can the solution damage your teeth, but it can also cause gum inflammation, which is very expensive to treat. It is best to visit a dentist before undergoing teeth whitening with this product. The benefits of a bright smile can last a lifetime, but the risks outweigh the advantages of a bright smile. Thanks for watching. Please like, comment, and subscribe.